clinical correlates and clinical applications for your pathology flashcards for module number 2. We'll start with the quiz questions, so you can go ahead and add these in, and then when you are ready, you can resume the recording. Here's our clinical application for Raynaud syndrome. Now we know Raynaud syndrome is a pathology that is aggravated by stress and medications, but specifically for our purposes by cold. And that cold creates vasoconstriction of the smallest blood vessels in our nose, our toes, and our fingers. And because of that, one of our key interventions is to make sure that our patient stays warm. We have modalities such as hot packs and heating devices that create vasodilation. We will be talking about them in PTA 202 modalities. There are also modalities such as ice packs and ice massages that are contraindicated for this patient because we don't want that vasoconstriction. Patient education is going to be very important, talking with them about why they need to wear gloves in the summer in Arizona because of the change in temperature when you go into the air conditioning could be something very important. And making sure that they are taking care of themselves if they cut themselves, because a lot of vasoconstriction will result in not being able to heal well from cuts and scrapes and stuff. Aquatic therapy could be a problem because there's a significant temperature change when you get out of the water. So aquatic therapy may not be the most appropriate for this patient. And then we do need to watch out for this orthostatic hypotension, which is when you pass out when you stand up. So a lot of us have probably had this happen where you've gotten up too quick and you get a little fuzzy. Because of the medications this patient is on, they can have this incidence of orthostatic hypotension increase. So just be cautious. So what does it look like? Raynaud's, what does it look like? So we see that, you get something as simple as Frankenfinger here, where it's a completely different color, but you'll notice the tips of the fingers are turning blue. This is really bad news because those fingers are completely cyanotic, completely blue. They're not getting any blood flow, versus these ones are white, which also isn't good, but you can see signs of Raynaud's and how it literally is just cut off from that blood flow. Venous stasis, aka venous insufficiency. The gold standard for treatment is going to be compression. Now there are two different types of compression that we'll be talking about. There's the ones that are strapped to your bed. This is much more DVT prevention that you see here because it requires electricity, and patients with venous stasis oftentimes are up and moving around a lot. They can't be tied to a machine that's going to compress the fluid out of their legs. So instead we're going to see that garments are the ideal standard. We may use these to help reduce any swelling, and then from there on maintain reduced swelling with garments. We do want to watch out for dependent edema. That means as the patient is walking around, the swelling is going to increase because gravity pulls the blood flow back down against the valves of the vein and against the push of the heart on our blood pressure. The patient is going to maybe need to take rest breaks and put their feet up so that they actually help drain that blood back towards the heart. And then wound care. We will be talking about how patients with venous stasis have this significant amount of pressure within the skin. And if they accidentally cut themselves, that inward pressure pushing outward on the skin keeps the skin open. So we may need to discuss with the patient how to apply pressure to the outside of their leg to kind of close the pressure like we would on a balloon that's been burst open. How do we apply pressure from the outside in order to make sure that the wound edges come together and the patient can heal? So this is what venous stasis actually looks like. You can see this brownish skin here, brownish reddish hemosiderin staining. The calves are a little bit bigger than normal size, so you can see how you would think like, wow, that's hypertrophied, but that's all swelling here. There's a lot of fibrotic tissue around the ankles, so they might have skinny ankles but bigger calves there. A lot of times we'll see that the skin kind of just flakes off. They could have wet feet, kind of a wine glass shape to their leg. Those are all signs of venous stasis. Let's talk about CHF. And ways to measure CHF, we have two options. We have the ejection fraction, which is the percent of blood that the heart ejects from the left ventricle during each compression. Normal is about 60 to 65%. You could also see the New York Heart Association heart failure classifications. So the different stages of it. So usually these are reliant upon dyspnea, so difficulty breathing. So this patient with a heart failure classification of 1 might have some pathology, but no symptoms and no limitations in their day-to-day life. This one has mild symptoms, maybe during some ADLs, significant limitation, only comfortable at rest. So anytime they do anything, they would get dyspnea or difficulty breathing. And these patients, even at rest, have symptoms or difficulty breathing. So it's a lot of it is based upon what they can do without having that difficulty breathing. So interventions, again, focusing on exercise, with an increase in endurance and working on quality of life. We start slowly, like a snail, and progress slowly, like a snail. This patient is going to have tachycardia and dyspnea, difficulty breathing at rest, or shortness of breath at rest. What we should see occur with exercise over the long term is that the dyspnea should lessen. Over the short term, anyone who's exercising should have an increase in heart rate and blood pressure. If they don't, we're going to see this as a problem. This is a red flag. We need to get help right away if there's no increase in blood pressure or heart rate with exercise. We also want to avoid isometrics, because holding our breath and during something like weight training or just isometrics in general can cause a lot of abdominal pressure and pressure on the heart itself. And so we don't want to increase pressure on the heart, or it makes it harder for it to work. So we're going to avoid those in our severe cases. PAD, this is peripheral arterial disease, and the primary sign for peripheral arterial disease is intermittent claudication. This means the patient has pain with walking or gait or standing for long periods of time because the calf muscles are not getting sufficient blood flow or sufficient oxygenation. When they sit down and rest, though, the pain recedes. So, therefore, this is the sign for therefore, is our 3 little dots there in that triangular pattern. Therefore, the patient will need to be educated on the need to take frequent rest breaks throughout the day, and potentially, if they're going to lock a long period, to plan for those rest breaks so that they have some place to sit and rest. One thing that you need to understand about peripheral arterial disease is how do we measure how bad it is. And measuring it can look at the ankle brachial index, so the difference between the blood flow at the ankle compared to the arm, and they actually have a whole scale to determine if the ankle has a significantly less blood flow than the arm and how much less is normal and whatnot, because there is going to be a lot less blood flow to the ankle as far as the amount of pressure, because it's just farther away from the heart as compared to the brachial and the arm. One quick way that we can do it is capillary refill. So if you look right now at your fingernails on your right or left hand, and you press down on the fingernail, and you're going to see it turns white. So you're going to press down and then lift up right away. It'll turn white and then it'll turn pink. We normally should have a pretty quick capillary refill. We should see that it turns pink within the first couple of seconds after pressing on it and releasing that pressure. So if someone has a delay, like it takes 5 or 10 seconds, we know that blood flow is really bad. Intermittent claudication, we know that gravity is going to have some sort of role with regards to our blood flow. So standing and letting gravity assist our arterial blood down is a good thing. So this for this patient, as opposed to our venous stasis patient who we had put our legs up, we know that gravity is not going to assist someone who is having signs and symptoms of intermittent claudication. So we just need to be careful there. Soft tissue work, we need to understand with soft tissue, heat, and cold that these patients do not have sufficient arterial blood flow. And without that sufficient arterial blood flow, they are not going to heal well. So if we damage them a little bit with our soft tissue, oftentimes, which is our goal to facilitate jumpstart the healing process, we could actually cause more damage and the patient might not heal from it. Heat and cold rely on the vascular system to dissipate or move the temperature change away from the surface of the skin via blood flow. So if the patient doesn't have sufficient blood flow, we could potentially burn them or freeze their skin. So we may need to ask about how bad is their peripheral arterial disease, and we might need to kind of measure that capillary refill or look into that before we just automatically assume that the patient would be okay. So we got some norms here for your capillary refill. We talked about 2 to 3 seconds. This is what we are looking at for someone who has peripheral arterial disease. You can see the skin is shiny. There's no hair. We may even see loss of nails. This is an arterial wound. You can see it's red and aggravated there, but it's nice and circular, and it's not like, it doesn't look like a great wound. You're like, that just doesn't look healthy. Of course, none of these feet look really healthy. You can see how skinny the legs are because a muscle deprived of lots of oxygen and lots of nutrients is going to eventually get skinny. You can see the wound edges are not healing. These wounds tend to be very painful because they're deprived of oxygen. So those are all signs and symptoms consistent with peripheral arterial disease. The shiny skin, the lack of hair, the skinny legs, the wounds that hurt, and just not healthy looking feet. Anemia is what happens when we don't have enough red blood cells. So hopefully you can name the general causes of anemia. How does this apply to us? So if someone is very significantly anemic, we must get physician approval because we can cause damage. Our exercises are designed to maybe cause a little bit of damage so that the tissues build up stronger. So if someone doesn't have sufficient oxygenation, they're not going to heal well. The patient's going to have dyspnea or shortness of breath. They're going to report fatigue, and we might even see some tachycardia as the body tries to make up for the fact that there's not enough red blood cells floating around, and so we'll increase the heart rate so the red blood cells at least circulate quicker. So be aware of all those things with anemia. And we talked about that physician approval is needed. In general, they're going to have an overall reduction in tolerance. Low hemoglobin is associated with an increase in mortality. So if you are consistently running low as an elderly patient, this could be a problem, as this is going to be a comorbidity, a secondary issue for other pathologies that's going to increase your risk. We see that a reduction in hemoglobin actually reduces the ability to perform activities of daily living in our older women. So a small reduction can have a profound impact, a multiplier by 1.5. So it's not a 1-to-1 ratio. It's even a worse predictor of a reduction in ability to perform ADLs. So one thing that we would do not only is just stay aware of their blood values, but monitoring their vitals if we know they're anemic, because we're going to see maybe some low diastolic blood pressure and some tachycardia again. Okay, that should be it, and we will see you for the section for Module 3.